If your kiddo is really particular about their clothing, they struggle with transitions from one thing to the next, or they just really don't enjoy high stress, loud environments, your kiddo may struggle with sensory processing disorder. Hey, I'm Dr. Sam McDonald, brain health expert, helping you rewire your brain so you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. So what is sensory processing disorder? If you're a parent of a kiddo who struggles with different things like clothing, textures, transitions, you may see some of these other soft signs or symptoms of this. But sensory processing disorder in a nutshell is a neurological condition where the brain does not perceive the body in an appropriate manner. It can be something as a sensory avoiding or a sensory seeking depending on what's going on. So let's dive into those two topics. So most parents in the medical profession understand sensory processing really in two ways, either an avoidance behavior or a seeking behavior. And if you're a parent, you'll understand both. If you have one of these, you'll understand which one it is. So with sensory avoiding, a kiddo is going to be wanting to obviously avoid these certain types of sensory input. So again, it could be things like clothing, whether it's the texture of it, the feel, tags, it could be the constriction, like wearing socks, or it could be other things like carpet, bed sheets, foods, things on their ears, hats. It can be really a different number of things, really how it's presented. It could even be how water feels on the skin, all these different kind of things. And the reason for that is because the way the brain is processing information, it's allowing too much information up into the parietal lobes or the sensory centers of the brain. Thus the brain's getting too much coming in from the body and it's overwhelming it. So that's why these kiddos don't like having some of these things here, because they can't filter out that information that's coming in from the body. Now, on the other end of this spectrum, we have a sensory seeking type of behavior, and this is where the brain is not allowing enough information coming in. So these are your kiddos that like to spin, that like to touch every single thing. They like a lot of pressure. Can be all kinds of sort of different types of experiences depending on the kiddo. But they're always going to be looking for that stimulation because their brain is not getting enough of that. Now, the interesting correlation with both of these in terms of a neurological aspect is both of these have pretty similar neurological mechanisms and injured or impacted areas. It just really depends on the kiddo of how severe and how much. So the most common areas that we see that are affected when it comes to sensory processing is the brainstem area, and more particularly the right parietal lobe, the right sensory cortex. So why these two areas? Well, for one, the brainstem area tends to be affected a lot when it comes to stress and birth trauma. So when these kiddos are born, there can be a lot of axial traction put on the upper neck where the brainstem resides, especially during birth or C-sections. So with this axial traction or this pulling force can cause damage to the brainstem area, thus resulting in lack of or too much information running through the brainstem up into the thalamus and then into the sensory cortexes. So when the brainstem is underregulated, a kiddo is going to present with more retained primitive reflexes, or what are called frontal release signs, which then is going to lead to these sensory processes because their nervous system is not fully developed for their age, assuming they're over 1 year old. Now, what this means is that this is also going to affect things like digestion, sleep, as well as stress tolerance. So these are kiddos that are going to be either really highly wound up, they're just constantly stressed, and they're just always on edge. So that's what you're going to typically see with these kiddos that have a lot of brainstem dysregulation. They have problems with digestion, with problems with sleeping, with, again, sensory issues, as well as just overall being very high stressed. Now, the other area that's most commonly affected with this is the sensory cortex, again, more so on the right side because that has a bigger effect or a bigger view on our body. And that's also where a lot of this information is going to fire up from the body. So we feel our body in multiple different ways, whether it's through pain, temperature, light touch, deep touch, and vibration. However, when we're not feeling these things appropriately, it can be bombarding that right sensory cortex or under bombarding it, if that's even a word, to not get the necessary information. So that right sensory cortex is not perceiving the body appropriately. Thus, these kiddos are now feeling things like, I said, socks maybe feel like sandpaper, or clothing just feels all scratchy and itchy even if it's really soft. Or again, if they're not getting enough information coming in, then they're just not getting that activation. This part of the brain fires into the front part of the brain up here, which can lead to problems with focus, attention, concentration, and even even like tics or repetitive type movements. It can be vocal, can be movement disorders, whatever those things too. So it can tie into that as well if they're not getting enough information. So To recap, sensory processing disorder is a neurological condition that is, one, reversible, but it's where the brain's not perceiving the body appropriately. So if you're a parent of a kiddo and you're wondering, hey, does my kid have this? Start to look and observe and see, do they constantly have to have similar types of clothing, or do they avoid certain types of clothing? Do they thrive in environments with a lot of other kiddos, like they have a lot of friends, or are they one that tend to avoid those sorts of things? Are they a particularly high stress child and just really easily overburdened? In their earlier childhood, do they have a lot of ear infections and colic? That can be another neurological sign of this. Do they have problems with digestion or problems with focus and attention, or nonverbal, or verbal tics or those sorts of things, or even movement toward sort of tics? These are all signs that can be linked with a sensory processing disorder issue. So in order to really get a further evaluation, you need to look at somebody who is an expert in neurological rehabilitation or a brain-based chiropractor. So on that note, you should be healthy by choice, not by chance. And for that reason, I will see you on the next video.